Every day around the globe, a growing number of people face mental health challenges, impacting their sense of well-being. Mental health conditions affect 1 in 4 people in any 1 year. But no one should have to face this alone.
I was having a lot of nightmares from PTSD. I wouldn't go out of the house. I was basically a recluse. Now that I've got this dog, I'm not afraid anymore.
Lions and Leos improve mental health and well-being every day through service. Connecting with elderly, supporting youth, combating loneliness, and so much more. Human connection has always been at the heart of what we do. Our Mental Health and Well-Being Initiative expands our service to raise awareness, educate communities, and advocate for positive change. Here are some ways to get involved. Reduce mental health stigma.
Are you being bullied? Try calling a parent, teacher, a neighbor, or a relative.
The focus is education and giving people the tools that they need to have better lives.
Support youth and the elderly.
We do meditation and also a group discussion. I call it the safe haven.
We're working to improve the mental health of our seniors.
Educate communities through partnerships and resources.
If we can get more awareness out there and more confidence about talking about the topic, that creates then a society where people are more able to look for support.
Raise awareness and educate about suicide prevention.
We decided then that we'd do something towards suicide prevention, maybe making people more aware of where they can go if they have suicidal thoughts.
Advocate for funding and legislative support.
We have to build relationships with people and explain to them who we are and what we're capable of doing in the future.
We can do more together. So reach out to your community. Organize and participate in service activities for mental health and well-being. Invite others to volunteer. Doing good feels good and is good for your well-being too. Learn more and access resources at lionsclubs.org/mental-health.
Good evening, everyone. Thank you for joining us. For those of you who don't know me, my name is Shiana Jalat. I'm the Council Chairperson of Lions International Multiple District 306. And we are a family of over 18,000 Lion volunteers spread across the country. Mental health and well-being is now becoming one of our key focus pillars when it comes to the service that we do. And we are, in our own small way, doing what we can to create awareness about this program and this initiative. And we have with us, before that, and in light of that, we signed up a partnership MOU with Sri Lanka Sumithrayo. And through the connections with Sri Lanka Sumithrayo, it's our wish to create more awareness, have our Lions clubs and our Leo clubs getting involved in conducting mental health programs, not only now, but going forward as well. And I'm happy to say some of our clubs have already done that. And this first really came about because we had an International Mental Health Awareness Week sanctioned by Lions International, with Lions all across the world working on programs such as this. So through our partnership with Sri Lanka Sumithrayo, Suranjani, who's also a friend and a Lion, connected us with Professor Waas, who will be our resource person and spokesperson today. And it's a very important topic that we have. And I'm just going to look for Professor Waas so that I can spotlight her. Give me a minute.
Hello, I'm here.
Yeah, just there you are. Then let me pin you. Right. So we have Professor Dulshika Waas, who has joined us today, and I'm really not going to take a lot of time talking, but I'm going to give a brief introduction about her because it's the most important thing is what she will be speaking about. And Professor Vaz is the professor in psychiatry, Faculty of Medicine and Sciences, University of Sri Lanka. She also works as an honorary consultant psychiatrist at the Colombo South Teaching Hospital in Kalabovila, and a very busy lady who has volunteered her time and her resources to share some thoughts with us today. And without any further ado, I will hand over to Professor Vaz. So just a guideline to all our viewers who are here today, this meeting is being recorded and we will be sharing this on social media. It'll all be also going on Facebook and all the other channels because we want as maximum exposure as possible. So Professor Vaz, may I request you and invite you to address all of us on a very important topic, the invisible struggle. See the signs, get the support, because this is a phenomenon, this is a situation, an issue, a struggle that cuts across all social strata, all ages, all gender, and everyone else. So over to you, Professor Vaz, to take us through this very important topic. Wait, you're muted at the moment. Okay.
So thank you very much, Shiana, for that kind introduction. And I'd like to thank the Lions Club and the Sumithrayo for having invited me to talk to you about a very important aspect. That's mental health awareness, which most people try to, cover up, and as the topic states. And both your clubs, as you have mentioned, do a lot of work with regards to mental health awareness and helping people, not only awareness, in a rather quiet way, I suppose. And I'd also like to thank Miss Suranjani Vikramaratne for having invited me. So going back, Suranjani's sister and I are friends, and Suranjani was the head prefect when I was in school at some point. And so that was an extra honor for me when she asked me to do this talk. So I'll talk to you about this important topic, and let me get my slides down. I want to see my screen.
We can see, Professor, not the file, but the folder.
You don't see, oh, okay. You see what's happening.
So if you have opened that folder, you'll have to share that.
That's, let me see.
Sure.
So, sorry.
No, that's fine.
Is that okay now? Or?
Right. Yes, we can see it. It's not on screen mode, but that's okay. If you can just make it a bit bigger, then everyone can see it.
I'll put it on
We
screen.
can see.
Is that better?
Yes,
Is that
that's
okay?
much better. Yes, thank you.
Right. So as Shiana said, my topic today is on the invisible struggle. See the signs, get the support. Now, when I sort of came across this topic, the first thing that came to my mind was none other than Robin Williams. Everyone knows Robin Williams. I asked Suranjani about the age groups are going to be, she said 30 to about 70 years. So here we have Robin Williams, who also struggled with mental health issues. And however, I think most people knew that he was struggling with these. And I thought I'll just show you this. Are you all able to see this video?
MCC, good evening.
Yeah, Professor, the
Yeah.
sound is not being shared. We can see the video with the the captions. I think when you're sharing it, you have to say share audio also.
That's the only video.
Okay, that's fine.
So that's Robin Williams, bringing happiness to everyone else, but struggling inside him. So by the end of this talk, if I can convince you to make the invisible struggle visible, I think I'll be a happy person. And that's my goal for this presentation, to make the invisible struggle visible. So during this talk, what I'd like to talk to you about is, obviously it's mental disorders that you're talking about. So what a mental disorder is, why is it invisible, who is at risk, early symptoms that we need to identify, and some of the common disorders, and of course, my conclusion on this. So we'll go to what disorder. It's a condition where your thoughts, emotions, and behaviors all go haywire. And in turn, it has a negative impact on your life, on your daily life, your family life, with work, school, socially. So for example, if I'm feeling low, that's my emotion. I'm feeling a little depressed. And my thoughts are also, I feel I can't do that. I'm useless. I don't have the energy to do that. So those are my thoughts. And in turn, what do? I take a step back and stay off work. So I try to isolate myself from people. I don't go because I know, I'm not going to be able to do as much as I did before. I don't want to feel useless. So that is how our thoughts and behaviors are all interconnected. And in turn, when it plays a negative role in our daily life, that is when what we call a mental disorder, right? So next question is, why is it invisible? Is it actually invisible? Well, there are so many reasons for it to be invisible. That is, because it can be invisible. Late stages too, to a certain extent. But as I said, it is invisible because of so many reasons. Complexity is one. Stigma is another. And in the introduction, I think it was said that you all are doing a lot of work to reduce stigma. Self-diagnosis, probably because of stigma and myths, and of course, social media coming in, also makes it invisible. We ourselves, we do talk to people. The next thing is the myths surrounding mental disorders or mental illnesses. Now, mental disorders are one of the most pervasive and challenging issues, of course, we see today. There is a huge impact, and mental disorders are often overlooked or misunderstood. Most people don't want to associate themselves with people who have mental health issues. They're worried, they're scared. Another reason could be that it manifests in different ways, just like any other illness. Now, dengue manifests in different ways in different people. Same here with mental disorders, it can manifest in different ways. Depression will manifest in different ways in different people. However, the issue is we don't have any blood tests or x-rays or scans to diagnose mental disorders, right? Another thing is the way sometimes we struggle against these symptoms. We ourselves don't recognize that this is a problem. I feel a little low, or I feel tired, but I still continue with my work. I push, I struggle, and I continue with my work, despite feeling a little tired. And I don't really realize that I'm feeling tired. It's only when I'm not tired that I realize, oh, goodness me. I mean, how did I manage all that during that period? Okay, so that's one of those other things. It's not recognizing what we feel. You can't blame people because, say, if you fall and you hurt your arm or your leg, what happens? You go to a doctor immediately. You're in pain, you go to a doctor immediately. But here, we don't. If we feel a little low, we take, if you're unable to sleep, we take our time. Most of these things come together. We feel low, we are unable to sleep. And it is only at the very end, when we just can't cope, that we go see a doctor. Okay. Another thing, as I said, was stigma. If I'm seen at the psychiatrist, what will people think? They think I'm going mad. If I tell my doctor, I'm feeling slightly paranoid about people, my GP, what will he think of me? Will he think I'm mad and send me to a psychiatrist or not treat me? So I don't want to tell them that. So that's the stigma behind all this. I take alcohol or I take substances. I don't want people to know that I'm dependent on it. I'm struggling because of this. Self-diagnosis is another huge issue. Because I don't want people to know, I try to diagnose myself. Or I dismiss it. Oh, it's just feeling a little low. I'm feeling a little tired. That's okay. I'll get over it. It's just this period. But this period continues to grow and grow until I'm not able to function. And I think social media is also to blame, because they encourage a lot of self-diagnosis. It has its good points, of course, because people are made aware of a certain mental disorders, but they overdiagnose sometimes, or they don't diagnose, or give the wrong diagnosis. Now, myths here in Sri Lanka are rampant. So some of the myths are, I'll just put it on the screen. Mental disorders happen only to people with a weak mind. No, It can happen to anyone. The high functioning person might also be undergoing a mental disorder. So even the brightest of the people can have a mental disorder. Beautiful mind, what happened there? One of the brightest people, he had a mental disorder. And then, of course, we think these mental disorders are caused by spirits or karma. Or it's God's will, so we don't bother. No, God will never do that. Spirits and karma don't play a role. These things, the mental disorders, are caused by other reasons, which there are risk factors. There can be biological factors, social factors, psychological factors, which contribute to mental disorders. And then when it comes to children, we think, how can children have any mental disorders? No, they are also likely to have mental disorders. We think it's poor parenting, and everyone else says, oh, that child is neglected. That's why this neglected by the parents. So that's why this person is undergoing all these problems. So you don't seek help for the child. And what happens in turn? Yes, they lose interest in whatever they're doing. They get isolated. Their education goes down. They're not able to keep up. So it's a vicious cycle. So that's children we are talking about, children and adolescents. It can't happen to them. That's a myth. No, it can happen to them. Then when it comes to the elderly, that memory loss is just normal aging. It's part and parcel of aging. It's something more, you see, and there is treatment available for that. And the elderly won't have any, if they haven't had mental illnesses or mental disorders right along, they're very unlikely to develop mental disorders. No, there's still a chance that they can develop things like depression or psychosis, even if they haven't had it at that point. So these are all myths which I hope I can debunk, which I did at this point. So ladies and gentlemen, we always think it's only the adults or the people who don't have money or the less educated or people who are not as bright who will be at risk. No, everyone here is at risk. But of course, the risk varies. You, including myself, I'm at a risk of developing a mental disorder. The risk will vary. It can be a small risk. It can be a high risk. And as I mentioned before, no age is exempted from a mental illness. The same way people would get dengue if a mosquito bites. Here too, people of all age groups could get a mental disorder. Now, WHO states that 1 in 4 people, I'm not sure how many people we have here, but 1 in 4 people will have a mental health issue at some point in their life. People are more prone to develop mental health disorders. Obviously, if there is a genetic predisposition, if there's a family history of depression, dementia, you're more likely to develop a mental disorder. It doesn't mean you will, but the chances. Mental stressors, workplace stressors, all those things also can lead to mental disorders. Psychological trauma, loss of a loved one, abuse, sexual abuse, physical abuse, emotional abuse, all this type of abuses, witnessing when it comes to environmental stresses, landslides, floods, can lead to our stressors, our risk factors to develop mental disorders. Now, certain medical illnesses too are risk factors, like having a stroke, having a myocardial infarction or a heart attack, diabetes, cancers, you name it, they're all risks for developing mental illnesses. But please note, just because you have one, it doesn't necessarily mean you will get it. So these are all risks. Okay? So now I spoke about the risks. Now, main thing is to identify the early on. So I know these are very small slide, but I'll zoom over it. As I said, now mental disorders comprise of emotional disturbances. One is feeling very low. You're feeling down. You're feeling depressed. You get very irritable. You've been a very calm person, patience, but suddenly you're getting irritated with people. It could be your it could be a family, or it could be people at your workplace, all that. And then you feel that your mood is also unstable. It keeps changing, right? So these are some of the emotional disturbances we may feel. Then the way we think. So we might be pessimistic. Oh, this is not going to work out. Someone who was very positive, had positive thoughts, suddenly thinks, no, it's not going to work. Might as well not try, all that. Then you think, okay, I couldn't do this because of this person. This person is not helping. The person who managed to do things is suddenly putting the blame on others, right? And suddenly feeling all, muddled and very doubtful. I'm not able to do this. I wonder if so-and-so is trying to block me. Is he trying to put me down? Is he trying to get me out of my job? Is he planning on doing something? So you start getting suspicious of people. Right. So next thing we come to are the physical symptoms. So these are also called biological symptoms, which are seen in almost all mental disorders. It's not all, but some of them can happen, can be seen. So chronic fatigue, you're feeling very tired. People who feel depressed sometimes feel so tired, but they ignore it. Sometimes appetite. Person who enjoyed his meals will suddenly will not have an appetite. And you will have a few, you might have aches and pains, because of this, of a mental condition. And you attribute it to a physical illness. It could be a physical illness, but doctors do all the tests, there's nothing found. But it could be due to a mental disorder. Because of these things, you can also, some of the other physical symptoms are your immunity goes down. And when your immunity goes down, you're bound to get other illnesses, other physical illnesses as well. And sleep. You might not be able to fall asleep. You might be getting up early. You might be having intermittent sleep. You fall asleep, you get up again. You keep getting up for various reasons. And you're not able to fall asleep soon after. Some people get up once in the night and then you fall asleep immediately. Here, no, you keep tossing and turning in bed. Or else you get up early in the morning and you're not able to fall asleep again. So these are all the physical symptoms that also come about with mental disorders. So if you remember, I defined a mental disorder to have physical, effect of emotions, thoughts, and behaviors. So because of your emotions and thoughts, there are bound to be behavioral problem changes as well. So you keep putting off things. Right? Someone who used to be punctual, do things early, you start putting off things. No, I'll do it later. I can't finish it, all that. There might be work absenteeism. You can't be bothered going for work now because you're tired, you can't get up. Or it could be that people at work are, plotting against me. You might suddenly be impulsive. You suddenly decide to go, throw a party for no reason at all, or something which you can't afford, right? And you might be isolating yourself from people because you can't be bothered being with them. You want to be alone. You don't want to socialize. Someone who used to socialize suddenly thinks, no, I can't. I want to be alone. And I don't want to be with them. I don't want to meet my friends. I don't want to meet my relations. Or it could be that you're thinking, I want to be alone because these people are trying to do something to me. So that's also one thing. And another behavioral change could be you resort to taking drugs, illicit substances, or alcohol, and nowadays there's also addiction towards social media and gaming. So these are also behavioral changes which we might notice early on. So again, something else is lack of enthusiasm. You're not able to focus. What you could do in 5 minutes, you take half an hour to do. You feel unhappy. You don't want to go on. So these are other behavioral changes. Now here, I'm just telling you, these are just symptoms. And one symptom alone does not mean you have a mental disorder. And I've told you what the possible symptoms are to recognize things early and not to diagnose yourself. And no circumstances should you diagnose yourself, right? And don't get alarmed just because you have one symptom. One symptom doesn't amount to a disorder. It's a collection of these symptoms that amount to a disorder. And of course, the impact it has on your life. So there are emotional problems, there are problems with your thinking, there are problems with your behavior, and of course, problems inside you as well. The biological problems are also there. This is a nice slide, which I thought would be good. So as I mentioned, feeling sad, you have issues concentrating, you're irritable, you can be suspicious, you have problems sleeping, you take excessive use of alcohol or drugs, you're not able to cope, your mood keeps changing, or it gets to be very low or very high, or it keeps fluctuating. And something which is also high is suicidal thinking. And I have to mention that because Sumithrayo is organizing this. It's not just because Sumithrayo is organizing, but suicidal thinking, suicidal thoughts are something which people actually hide within them. They don't want to talk about it. they're scared to talk about it. And even if they do talk about it, people are scared to listen. So these are all things which we have to recognize early on, and then it becomes easier for us to deal with. So I just thought I'd put this slide about warnings of suicide. So people talk, sometimes they take great risks depending on their mood. So someone might suddenly, a good driver might suddenly start driving very fast, jumping the traffic lights, things like that. They may do. They may also talk about feeling empty or not happy. They may talk about wanting to die. And then some people say, oh, just get on with your life. What's this nonsense? You have everything in your life. But people who have everything in their life can also feel like this. It's not because they have everything that they're feeling like this. And they may talk about feeling trapped. And, because I'm depressed, I'm a burden to others, so I don't want to live anymore. So these are all, so pain again is another thing which people complain about. And they may start, slowly withdrawing from family and friends. They may have, now with social media, they may post different such posts with suicidal thoughts. They may do last acts like, and say goodbye to people and write notes or give away their belongings, done in a very subtle way. So these are also things which we have to keep in mind. So I spoke about the reasons for this, and for these things to be, the struggle to be invisible. And I also spoke about some of the early symptoms which we need to identify and recognize in us as well as others. Now, that doesn't mean you go diagnosing others, just you see someone feeling a little low and think, oh, goodness, this one is depressed. No, it doesn't happen that way. Most of these things there has to be a duration. Some things like at least 2 weeks if you haven't been diagnosed before. So these symptoms, these combination symptoms have to be present for a certain amount of time. Okay. So coming to the 5th section, that's the mental disorders. Now, there are about the International Classification of Diseases by the World Health Organization, which we use here, has about 200 mental disorders. But here I thought I'd highlight some of the more common disorders that you see. So depression, anxiety disorders, bipolar disorders, schizophrenia, obsessive compulsive disorder, post-traumatic stress disorder and other stress disorders, attention deficit hyperactivity disorder, also known as ADHD, eating disorders, not very common in Sri Lanka, but seen. And of course, this little thing is addictions. So let me move on to the next slide to show you what each thing is. So this is not for you to diagnose. I'm just showing you what the symptoms are. So when one feels depressed, it's a mood disorder. So you feel low in mood. And in turn, you don't want to do things you enjoyed doing before. You don't get enjoyment by doing things you did before. Your energy levels are low. You might become irritable with people. You might, your eating habits may change. You have no interest in eating. You don't have an appetite. In turn, you lose weight. Your sleep will change. You might have difficulties falling asleep, or you may have difficulties, or you may get up early in the morning and not able to sleep, get back to sleep again. Having said that, you might try to reduce these things, these feelings, by trying to take alcohol or substance just to improve your mood. And in turn, substance misuse, like alcohol plus substance, including tobacco, makes it worse. Right? So these are symptoms of depression. So when it comes to anxiety disorders, we are worried. In a nutshell, we are worried about things unnecessarily. We all worry about things. But here, it's blown out of proportion. So, you're imagining the worst case scenario. You're supposed to drive a long distance. And then you keep thinking, my goodness, there have been so many road traffic accidents. Will I meet with a road traffic accident? Possibility is there. We all think, okay, I go on a long trip, going on expressways and things the way others drive, the way you drive, you might meet with an accident, but it takes over your life, and most of the time you're thinking about it. And because you feel anxious, you avoid the situation. Now, say for example, I feel anxious when I'm doing a presentation. So what do? I avoid. I find some excuse or the other and avoid presentations. And because of this, you will also have other changes, like your heart pounding. You feel your heart pounding. You might have difficulties breathing. So the physical aspect of things will also come in. And you're unable to think of anything else other than this. So there are lots of anxiety disorders. Like one thing is generalized anxiety. You're anxious, you feel on edge for no reason at all. You don't know what you're anxious about. But it plays a major role in your life. Because of that, you're not able to continue your work. Then you have social phobia. You're unable to, you fear meeting people, making presentations, things like that. Then you have other types of phobias, like agoraphobia. You feel scared in an enclosed place. So because of that, you don't travel in buses because you can't escape. You don't go in a crowded bus. You don't go in elevators because it's crowded, and escape is not easy. And therefore, you avoid. So those are anxiety disorders. And then we move on to another mood disorder. That's called bipolar disorder. Just as the name suggests, it has two polars. So I mentioned the depressive symptoms before, a depressed person. Now, these people have both depressive symptoms and manic symptoms. So the depressed person, obviously the mood will be low. The manic person or hypomanic person will feel on top of the world. So the manic person will feel, my goodness, I have energy. I can stay up until late. I'll be partying. I'll finish all this work and I'll go out of Colombo tomorrow. But the depressed person will feel low. Both parties may take excess substances. The manic person wouldn't want sleep. They don't feel the need for sleep. Whilst a depressed person might want to sleep extra, won't be getting enough sleep. And as I said before, this person will be, the person with mania will have racing thoughts. The thoughts keep changing very, very fast. And they think they can do anything they want, which of course it becomes a risk. But a depressed person thinks, no, I can't do that. And so it's two sides of a coin, basically. So some people have, people with bipolar disorder could have manic symptoms and in turn, depressive symptoms at different times. Right, so next we get to people with psychosis. That's also another common disorder. So there are the people who have hallucinations. That is, they may hear someone or people talking to them about them without anyone being around. Or they could be paranoid. They might think so-and-so is trying to harm me. Or they may think, okay, so-and-so or my spouse is having an extramarital affair with someone else. I don't even know who that is. So they have delusions. Then their thinking will be all disorganized. They may feel that people are putting things into their head. They may feel that people are, not that they feel, they believe that people are putting thoughts into their head. They believe that people are taking thoughts out of their head. So all your thoughts, your private thoughts, are being taken out of your head. And sometimes they believe that their life is being projected on screen. And again, with hallucinations, there's something called running commentary, where they hear people talking about all their actions. So you go to the toilet, or this person has gone to the toilet, they're doing this, this, this. So it's a very distressing situation for people. And in turn, what they do is, they might try to harm themselves because it's too much to bear. Or they might try to harm the other person. Or they may try to resolve these things by taking substances. So they have psychotic symptoms, that is like hallucinations, delusions, disordered thinking, like that. Finally, addictions. As I mentioned before, there are lots of addictions. There is gambling, now there is gaming, alcohol, substances. You might be addicted to certain medications. So you have to draw the line between just say certain things like harmful use versus use. Now, when one is addicted to something, they need to have it. If they don't have it, they get what you call withdrawal symptoms. And this plays a huge role in their lives. So your social life, sometimes time you spend with your family gets less because you have to go have a drink or play this game or go gambling. So everything, this takes precedence over your life, basically. And in turn, it ruins your life upfront. So all the things I discussed just now is seen amongst everyone. There is no distinction in age. So children, adolescents, adults, and even the elderly can have. So sometimes you think the elderly can't get depressed. They've never been depressed, so they won't be depressed. No, they can get depressed. They can get psychotic later on in their lives, where they feel paranoid about people. right? They may start taking substances, alcohol later on in life, more than what they used to take, to abuse it. And of course, with the elderly population getting bigger, we have to face the fact that dementia is also getting to be more. So dementia is not just merely memory lapses. And most people think the older you go, it's a risk factor. The older you go, the more likely you will have dementia. And yeah, so some of the things are here, you could have memory lapses. Towards the end, you may get disoriented to time and place. Familiar tasks can get to be difficult. I used to, go on the computer. That person is not able to do that. They'll have difficulty counting money. Suddenly, you're not able to write coherently. You're missing out words. Your judgment can be reduced. You start misplacing things. And it is because of memory that you start misplacing things. And in turn, you start accusing others of having done that. So you withdraw from work or social activities. And there's a change in your behavior, mood and behavior as well. It could come to a stage, these are not early warning sign, but a late sign that a place you used to go frequently, you might not be able to find your way back. So dementia is something which we have to keep in mind, at least identify early so that people can be helped with with dementia, and they can also organize their lives as well as others. Now we come to children and adolescents. I know there might not be children here, but there might be parents. So the startling fact is, research has shown that nearly 50% of mental disorders develop before the age of 14. Right? A little shocking, but that's the truth. So some children can have all these things just like adults. Children and adolescents can have depression, bipolar affective disorder, anxiety disorder, just like adults. But they are not able to express themselves. So because of that, the presentation might be different. With regards to depression, now generally in adults, they have issues sleeping. But here in the depressed child or adolescent, sleeps a lot. They'll be functioning very well. They'll be top of the class, they'll be the most popular person, but they'll be feeling depressed inside. And they may not know how to say that. So in turn, they might be taking risks. There's a lot of reckless behavior. So unprotected sex is one of those. Taking alcohol, gaming, using drugs, all that is seen in adolescents who are depressed. And their work will deteriorate. Their schoolwork will deteriorate. They might be not socializing with their peers, or they might be socializing excessively. So all those things are there. So what are the symptoms we should observe in children? If they've been okay before and they have issues paying attention, sitting still, then suddenly they start to worry for no reason. They don't want you to go out of home. They don't want to go to bed. They want to come and sleep with you. So they might be having nightmares. So they don't like their favorite activities. or there can be aggressive behavior and problems with school or friends. So those are the symptoms you might want to see in children, you might see in children. Excuse me. I thought I'd bring up ADHD in children because when you don't diagnose early and get help, it's not just medication. There is also ways of helping them behaviorally. Because they may be intelligent, but there is a deterioration in their work, which is sad. So 3 key features is inattention. You'll see them not paying attention in class. They're easily distracted. The teacher will say, after 5 minutes, that's it, he's thinking of something else. They'll be hyperactive. They'll be fidgeting around, squirming. They'll blurt out answers. They don't wait for their turn. And they might be impulsive. They take a lot of risks. And as I said before, they might not take turns. And people also make use of this. The fact that when others know that they're impulsive and get them to do things on their behalf. And because of their impulsivity, children with ADHD are also likely to get abused. So in a sense, I hope I didn't make you more depressed. It's just being aware of these things. So once you're aware of these things, what do? What's the way forward? Don't suffer in silence. Speak to your healthcare provider. You can speak to your GP, your general practitioner. If things are mild, you could go see a counselor or a psychologist. And if needed, they'll direct you to a doctor or a psychiatrist, right? So there are psychiatric clinics all over the country. Most base hospitals have psychiatric clinics. And yeah, and if you are in a crisis and you need help, 1926 is a toll-free line. It's there 24/7. You can call them. CCC is also another crisis line. And of course, Sumithrayo. So seek help. And if you see that someone needs help, encourage them to get help. So in conclusion, I discussed about mental health, what a mental disorder is. I spoke about why it becomes invisible. It's due to the complexity, stigma, myths, all that. The possible symptoms. And please remember, it's not just one symptom, but it's a combination of symptoms. And and finally, I think I pressed, sorry. Finally, what I'd like from you or request you is make the invisible struggle visible. That's where you can and will get help. Thank you then. Are we having a question?
Yes, we can. Remove the spotlight. Thank you so much, Professor Waas. It was truly an eye-opener, and when you were speaking, I was sometimes thinking of the way I act, and I was wondering, oh my God. So, but then you told not to self-diagnose, so I did not. But so everyone, you can ask questions. You can either raise your hand or type it in the chat box, and I will take it up with Professor. Professor There is a question actually I typed out before I could forget, especially when it comes to kids. How can, what can we do, or how can we speak to children to understand that what they're doing is a disorder and not merely normal emotions and behavior? Because some of those, let's say, ADHD symptoms could be in isolated cases normal kids behavior, like jumping in to do something or but how would we extract the fact, especially a parent or someone seeing these kids, where I can say, look, we might need to have a talk because this could be a disorder as opposed to just normal childlike behavior, as we would put it.
Yeah, Shanna, sorry, rule of thumb is if you're unsure, ask, see a doctor. Because we pass off quite a lot of, behaviors, kids being kids, kids being mischievous, but there's a lot more to it. So, and another thing which you have to realize is it's not a one-off thing. Most of these things are pervasive. It's there for a while. And if it's affecting their work, affecting relationships, that's when you realize, well, something has to be done. And it's ideal, it's good to do it early than late.
Thank you. Any questions? We have a couple of minutes. Yes, we know you can unmute yourself and
yeah. So basically, this is a subject that is very close to my heart. The first point I like to know is how do I meet somebody with regard to what I'm going through with patients, and also the existing laws we need to reform the existing laws. These are going back to, I think, 18th century, right? So, in fact, I have an article with me by Kusumanjali Tilakaratna, where in 2023 she says the urgency of reforming the laws, but nothing has happened, right? Also, and how do I meet either the Lions or Professor Waas or somebody, because there is a lot we need to do with regard to awareness. Now, this year on Mental Health Day, I didn't see very much being said on TV. There was on Facebook and things like that. But, there are victims, there are patients, there are people who abuse them. So there is a lot that I need to share with somebody. I need to know whom to contact. And also, 1926, is it a confidential line, or is your confidentiality?
Oh, yes.
It is, right, it is. Because I have a story, Professor, and the Lions, right, which is, I think, the only in Sri Lanka. So I really need to put it out, and it can be a case study for a lot of you. So if I can get how do I contact somebody, that would be great. So, because this is where we can improve, and I'm willing to support, and if I can meet somebody,
So, if you can into the chat box directly message me your contact number.
Yes,
I can definitely connect you with Sumithrayo.
Chat box, yeah.
In the chat box, I will connect you with Sumithrayo because they are trained.
No, I have been there.
So I put in touch directly with a person rather than a general number. That is one. Maybe Professor Waas, you can give some thoughts on who else she can speak to, but definitely I'll connect her with Suranjani and the team at Sumithrayo.
Right.
Thank you. Brought up some important points. It's just that I think the college has been pushing for these reforms. Like the Mental Health Act, it's ancient. But,
1883.
I have no comments as to why. I'm powerless. I wish there was politico here who can do something. Well, fingers crossed, hopefully something will come out of it.
This is where I feel Lions can really come in. That's what I say, awareness.
College is trying. It's trying.
College is trying, right.
The Sri Lanka College of Psychiatrists, the professional body.
Yeah.
trying their best, and they've had lots of meetings with the Ministry of Health officials and all that. But, you know, there are lots of stumbling blocks, just like everything else.
Right.
But if you wish to talk to someone, you can always go. All hospitals have a mental health unit. So
Yes.
if you want to talk to someone with issues, yeah, you could do that.
Will I be able to meet somebody at the College of Psychiatrists?
I am not too sure about
Right.
that, but you could always write a letter or email.
I have done that.
You have?
I have done that, yeah.
And there's been no response?
No response, yes.
So let's do this connection, we know, to see how we can get the rest with that.
Right.
As you know,
We'll take the others
end,
now. Yes.
From the Lions, we'll be doing in our own way advocacy and more awareness building, because we have to like talk about things from now on. And even in our clubs, we're encouraging them to handle it at club level, because as we said, it's an invisible sign and we're trying to make it visible. So thank you for your interest. I have actually got your number. I will connect you with some relevant people for us to take it forward as well.
Thank you. Thank you.
Professor, there is a question in the chat box. I'm not sure how vast it is. It's a bit open-ended. It says, how to escape a mental disorder. I believe it would be how to address it or something like that.
How to prevent, probably. Is that the question?
Possibly.
Good question. So a healthy lifestyle is needed. So nutrition plays a huge role. Managing your stress, exercising, and also what else? Managing your stress plays a huge role. Staying away from drugs, alcohol, tobacco, all those things plays a huge role. And managing stress itself is another topic, I suppose, to be discussed on another day. But sometimes, despite doing all that, you may still get a mental disorder. You can't help it. But main thing is to do all these things, and now yoga, meditation, all those things help with managing stress.
Professor, can it be where you get this, where it won't be a permanent condition? It can come and go during your phases of life, due to certain life experiences and things like that. Or is it to say that when you start off, it will thereafter be there always and things like that?
No, not all disorders are like that, but there are certain disorders which are there lifetime, throughout your life. But they're managed. Just because you have a disorder doesn't mean you have to stop work and stay at home. No, that's not the idea. You get on with your life. But there are certain disorders which are present just for a short time. Some people could have depression, just one depressive episode. And after they are treated, they don't need to be on medication after that. But again, it may come up in a certain year's time or may not. So certain disorders are like that, but certain disorders are lifelong, but they're managed. Key is, there is something which can be done.
Okay. Thank you. Thank you very much, Professor. Any other questions? If not, we will wrap up this session. There are a lot of good comments, Professor, in the chat box. And I also have our past council chairperson, Indra Kaushal Rajapaksa, on screen, who has joined this very important session from another important business meeting, which he was attending. So you can see the wait for this program. Okay. I'm also making note of all the notes in the chat box, Haris. I will connect you as required. So I'm not seeing any other content-related questions. Okay, I will now invite past council chairperson Indra Kaushal Rajapaksa to thank everyone who's here today.
Thank you very much, MCC, uh, Shana, Professor Dulshika Waas. I'm very happy because I was just monitoring all the chat messages, and also a couple of lions called me and asked whether we could repeat this session, MCC, for your information, right? Because it is so valuable, and I see our one of our international leaders was there in the program, and is still there. Our Nagaraju, uh, Governor P.D. Nagaraju is there, and many other overseas participants are there. So this alone shows the value of this program. And I think MCC, with the permission of Professor, if we could repeat this program once again, it will be very useful for our lions. So thank you very much, Professor, for imparting your giving advices and all this the program you did today. So this is very valuable, I would say. So I'm very thankful for our MCC for organizing this event, and all credit goes to her. Thank you very much for all the participants, all the lion ladies, for taking part in today's event. Thank you very much until we meet again. Thank you. Ayubowan.
Thank you, past council chairperson, and thank you everyone for being here. This session is recorded. It will be on our social media channels, Facebook. You can follow us, hashtag Lions of Sri Lanka. We have an official multiple district 306 Sri Lanka page. It will be on that. And I have made note, Sister Sharmila asked whether we can do a session on stress. So we will go through and do all of that. We are very, very grateful to Sri Lanka Sumithrayo for aligning with us, for joining with us, because they have the technical expertise and knowledge, and we are using our networks to take this message out. This is just an initiation. It's an ongoing thing, and every journey will start with one single step. And however small an initiative is, it will make a difference. So thank you, everyone. As you know, I always say, service is much more than charity. And this is yet another initiative that we have started and will go on progressing as Lions together with Sri Lanka Sumithrayo as well as all other partners. So thank you for your time. Thank you for your efforts. And again, Professor Waas, thank you so much. Really appreciate it.
Thank you for inviting me. It was a pleasure. And thank you for all the good work you're doing.
Thank you.
I'll be happy to support you.
Thank you. That means a lot. Thanks a lot. So good night, everyone. I will end the meeting now.
Thank you. Thank you.
Thank you.